Every day, your medical front desk absorbs a crushing volume of data. Between endless scheduling calls, patient intake, insurance verifications, and EHR data entry, the actual workload piling up on your reception team is far higher than what appears on paper. Because the margin for error is so tight, this setup is incredibly fragile. If just one receptionist calls in sick, takes a vacation, or gives their 2 weeks' notice, the ensuing backlog hits the entire office within hours. You are not alone in feeling this strain. In recent research published by Athena Health, according to American Hospital Association data, 1 in 4 physicians now cites a lack of support staff as a top workplace stressor. When patients wait longer, when calls drop, and staff burns out, it is not a failure of individual work ethic. It is a structural failure in how traditional practices manage their intake volume. Many practice owners assume the cost of their front desk is roughly equal to the base salary. On paper, a medical receptionist earns between $38,000 and $43,000 a year, but a base salary ignores the reality of loaded costs. Once you factor in benefits, payroll taxes, training time, office space, equipment, and paid time off coverage, the financial picture looks very different. This vertical stacked bar chart maps the actual math. We start with the $38,000 baseline, but when we stack the taxes, benefits, training, and overhead on top of it, the true loaded cost to keep one in-house hire at your front desk reaches $60,000 to $90,000 per year. And that assumes they stay. The Medical Group Management Association reports that replacing a single front desk departure adds another $9,000 to $12,000 in recruiting and lost productivity costs. This kicks off a predictable cycle. One person leaves, the remaining staff cover the gap and burn out under the extra load. Then a second person leaves, and you're forced to start the expensive hiring process all over again. The traditional in-house hiring model creates a compounding financial drain that eats directly into your operating margins. Solving the intake crisis requires a shift in the underlying mechanics of how front desk work is executed. Staffingly manages this by transitioning your reception operations to a dedicated virtual medical assistant model, utilizing administrative specialists specifically trained in healthcare workflows. These specialists connect directly into your specific EHR, learn your local workflows, and handle the entire suite of front office functions during your business hours. On the left, we see the steep $60,000 to $90,000 curve of an in-house hire. On the right, a dedicated Staffingly VMA starts at $1,800 a month, a 64% cost reduction. That gap collapses into $39,200 in hard savings per position every single year. The trade-off is clear. You relinquish the physical presence of a receptionist in your waiting room. In exchange, you gain massive, standardized financial relief. Any practice owner with a complex EHR environment immediately wonders if an off-site team will create more friction, or worse, make costly errors in patient charts. To prevent this, Staffingly deploys an AI auto-categorization layer that operates continuously alongside their human specialists. Incoming requests enter as a raw, disorganized feed. The AI categorizes every task by urgency, filtering them into clear lanes. Workload balancing algorithms then instantly distribute tasks across the human team. Edge cases are flagged, ensuring no single bottleneck ever forms. By removing the manual friction of sorting and triaging, Staffingly maintains an audited task accuracy rate of over 99% across its entire client base. Traditional multitasking forces a single local receptionist to choose between answering a ringing phone and entering data accurately. Pairing dedicated human specialists with intelligent automation solves that exact clinical problem. The final barrier for independent practices is the fear that outsourcing will compromise patient data security or cause weeks of operational downtime. Data protection is engineered directly into the platform. Every team member operates within an infrastructure that is strictly aligned with HIPAA, SOC 2 Type 2, ISO 27001, and HITRUST compliance standards. Once a contract is executed, the deployment timeline to go live takes only 48 to 72 hours. The structured onboarding process begins immediately with a 60-minute discovery session to map your specific practice workflows and configure secure EHR access. To eliminate disruption to your daily pair, Staffingly uses a risk-mitigated 10-day ramp-up, gradually shifting the team from handling 50% of task volume to 100%. You commit to spending a few hours up front outlining your workflows, Within 2 weeks, you receive a fully integrated operational workforce. This infrastructure scales cleanly. Staffingly currently manages these operations for over 800 healthcare providers across all 50 states. To ensure nothing slips through the cracks, your engagement includes built-in redundancy, a dedicated team leader, a process manager, and a customer success manager. Practice leaders never lose visibility. You maintain complete oversight through real-time dashboards and weekly performance reports that track turnaround times and task accuracy. If you are an independent or mid-sized practice actively bleeding margin and trapped in a chaotic staffing spiral, this solution is built explicitly for you. You can test the financial impact without risk. Staffingly offers a 30-day free trial with no setup fee and no long-term contracts holding you back. Your front desk is the operational foundation of your business. Protecting it means stepping away from the endless local hiring cycle and embracing a remote infrastructure that actually supports your practice.